Hello, this is Dr. Suzanne Fogger, and I would like to speak to you today about pharmacotherapy for substance use disorders. The medications that we are going to be talking about today help individuals who are having and are struggling with remaining clean and sober from alcohol, opiates, nicotine primarily, and we will talk briefly about cocaine and methamphetamines. The learning objectives for this session include identifying at least one FDA-approved medication for each of the four specific substances of abuse, state 3 common side effects for each of the identified medications, to be able to talk about physical and laboratory evaluation for monitoring the safety of 2 of the medications, naltrexone and disulfiram, secondary to possible liver toxicity. Describe key strategies for promoting medication taking behavior. Now, pharmacological intervention. Why would this be helpful to be able to think about treating individuals who are in recovery from substance use? What is the benefit of having medications? Medications that you can provide these patients can help interfere with the reinforcing effects of the drugs of abuse. They may interfere with drug binging, so that if an individual were to plan on going out and, say, getting drunk and drinking an excessive amount, which in terms of drug binging would be more than 5 drinks in a single setting, that the medication may cut back on this, so as opposed to drinking heavily, they may drink less than they had previously. May reduce drug-induced dopamine release so that the individual doesn't get the same pleasurable effect from the drug of choice. It may also reduce postsynaptic dopamine responses so that the individual doesn't have the same response. And it may also decrease the delivery of the drug to the brain so that they don't get the same effect from the same amount of medication. Now, the brain has over time responded to the effect of having the chemicals on board and may compensate for the adaptation either predated the use of the drugs or developed after long-term use, and that these medications that you're offering may help normalize the brain. They can also help decrease the prioritization of motivational value of the drug, enhance the saliency value of natural reinforcers so that other things that normal people find to be important can be reinforced by having the medication on board, and that having drugs on board, such as the medications we're going to talk about, may interfere with conditions responses, such as cues that they see in the environment that may trigger them to relapse. It may help decrease the amount of stress that they're under that may also trigger relapse and or physical withdrawal. So those are some of the things that we're going to talk about the benefits of these medications as we go along. Now, alcohol, we're going to talk about 4 different medications. The first 3, naltrexone, acamprosate, and disulfiram, are FDA approved for the treatment of alcohol use disorders, and topiramate is not, but because it's highly effective, we're going to talk about it anyway. Naltrexone competes with opiates for opiate receptors in the brain. Therefore, it's an opiate antagonist. It reduces the urge or the desire to drink. If alcohol is consumed, it decreases the amount that is drunk due to an antagonistic effect of the medication. You're probably thinking, okay, so alcohol, we know it affects GABA. In actuality, alcohol is not very discriminatory in the sense that it affects multiple neurotransmitters, including dopaminergic neurotransmitters and opioid transmission. So it is non-discriminatory. It affects GABA, it affects the opiates, it affects dopamine, and therefore this medication helps to reduce the urge or the desire to drink, and the individual, when they're on this medication, may drink less. Naltrexone dosage include oral and IM. The oral has to be taken daily, and the individual needs to consume at least 90% of the medication in order for it to be effective. The dosage are between 50 and 100 milligrams for the PO, Revia, and the Vivitrol, which is 380 milligrams on a monthly basis, which may be helpful for individuals who require supervision taking their medication, or they need to have it on a routine and consistent basis for blood levels to be effective. Side effects include nausea, headache, depression, dizziness, fatigue, insomnia, anxiety, as well as sleepiness. The primary side effects are nausea and headache, however. Naltrexone, to be aware, if you're going to start someone on this medication, they must be off of opiates prior to starting, at least 7 days before they start on naltrexone. You want to assess the pregnancy status. This medication is a category C. This medication is going to block the pain effect from other opiate medications, so if an individual is injured, they need to be aware that other opiates are not going to be effective. They can, however, have effectiveness for local or general anesthesia should they need it. It is also possible that non-narcotic pain relievers can be utilized, such as NSAIDs for pain relief. It's important that the individual, if they're taking naltrexone, inform other healthcare providers that they're taking this medication, because it can interfere with other medications, and so they need to share that with other providers and perhaps carry a card in their wallet that they're on naltrexone. Naltrexone, however, can have toxic effects on the liver, so it's important to evaluate liver functions prior to the onset of treatment and regularly during treatment. What you're going to be looking for is GGT, ALT, AST, and Billy, and it's possible that if you're treating someone for alcoholism that you may already have these drawn before you start the individual on naltrexone. Injectable form, you want to be sure that the individual who is giving the IM uses proper technique, and that cellulitis is a side effect that may be reported with this particular medication. It seems that women have more of a problem with cellulitis than do men. Another medication, a camprosate or Camprol, is available for treating alcoholism. This is FDA approved. This mode of action currently is unknown, but evidence suggests that its primary effect is to modulate glutamatergic transmission. So it helps to kind of slow down things in the brain, because glutamate is an excitatory neurotransmitter. It may also have an effect on the NMDA receptors and glutamate receptors, and it's going to increase the release of inhibitory neurotransmitter taurine in the nucleus accumbens. So they're not quite sure how it acts, but they do know that it can help individuals who are trying to remain alcohol-free or decrease their alcohol consumption. The camprosate comes in tablets of 333 milligrams, so the daily dose is 666 milligrams 3 times a day, which is important in the sense that the individual needs to take the medication 3 times a day consistently in order for it to be effective. Side effects include diarrhea, headache, anxiety, depression, suicidal ideation, fatigue, insomnia, anxiety. I repeated that twice, I know, but maybe a side effect of this particular medication, as well as sleepiness. It takes about a week for this medication to develop enough in the bloodstream for it to begin working. It's more effective if the individual has been clean and sober for at least a day or two before starting on this medication. Um, and this probably should be your second choice if treating someone for alcoholism, if the naltrexone was not recommended because of liver issues, or they couldn't tolerate it, or they were on a chronic dose of opiates for chronic pain, that this might be your second choice. It's excreted through the kidneys, so it would be perhaps a decreased dose with someone who's got renal impairment. It doesn't seem to pharmacologically interact with alcohol and medications metabolized in the liver. So should an individual have an issue in their liver, that this might be a medication that would be a good choice. Another medication that you probably would not want to use should someone have underlying liver problems is dilsurfram, better known as Antabuse. This medication has been on the market for a very long time, and it works essentially by creating an aversion to alcohol. It inhibits the enzyme acetaldehyde dehydrogenase from converting to acetate. So in essence, it blocks that conversion, and it accumulates to produce an aversive reaction, which the person gets sick if they drink when taking this medication. The effectiveness results from the person's avoidance of alcohol. And because its intended effect is to cause this interaction, should they drink, the individual doesn't want to drink or shouldn't want to drink. The alcohol disurfram effect includes nausea, vomiting, diarrhea, breathing difficulties, skin flushing, in which it feels like their face is on fire, dizziness, hypotension, and tachycardia. And the individual who's on disurfram should carry a card saying that they're on this medication, and it's important that they stay away from alcohol in any form. In hospitals in particular, hand sanitizers, which have alcohol as a base, can produce a alcohol disurfram reaction because alcohol can be absorbed through the skin. Aftershave would also follow suit, and mouthwashes and liquid medications can be absorbed through the oral mucous membranes, or if you're drinking liquid medications such as NyQuil, for example. It used to be that NyQuil had a high concentration of alcohol. Currently, I believe that you can purchase a non-alcoholic NyQuil. So these are some of the alcohol disurfram effect. Now, this medication comes in doses of 250 milligrams a day is the usual dose. It can range as low as 125 to 500 milligrams, and I've seen people initially may prescribe 500 milligrams for first week to get a good blood level and then decrease the dose. With this particular medication, it's important that they take it on a daily basis. It takes about a week for it to leave the system before an individual can safely return to drinking. And therefore, this medication is best used if the individual is monitored when they take the medication. Unintentional side effects include various types of neuritis, hepatotoxicity, confusion and psychosis, with really severe adverse effects should the person have alcohol with it, may include a myocardial infarction. They may develop congestive heart failure, respiratory depression, and death. So this particular medication has got some usefulness. It has some very strong side effects that may accompany it, and it also may have some severe adverse reactions. This medication, the disulfiram or antabuse, is contraindicated with drugs metabolized by the cytochrome P450 system, such as imipramine, warfarin, phenytoin, and various benzodiazepines. It's not recommended as a first-line therapy. This one might be one that you would reserve for someone who may benefit from aversion type therapy, in which if they drink they're going to get sick, and that may be enough to keep them from drinking. It's not recommended for individuals with a history of psychosis, cardiovascular disease, pulmonary disease, previous renal failure, diabetes, or over the age of 60, so that will eliminate a number of your population. Topiramate or Topamax. This is an anti-seizure medication. It's not FDA approved, but there are a number of studies out there that support the effectiveness of this medication, and it may be useful for someone that you're working with, that the other medications are either not appropriate, or that the individual has tried and they were not effective. So this might be an option. This particular medication facilitates GABA-mediated neuronal inhibition. It antagonizes some glutamate receptor subtypes. The dosage escalation is somewhat difficult, in the sense is that it has to be done slowly, and it's somewhat complicated if you were prescribing this medication to get a person up to a dose that was high enough. But sometimes writing down things and making copies so that the patient can take it with them may help ensure that they increase the dose as it needs to. The slow titration is needed to prevent side effects. This medication is excreted through the kidney. There are rare metabolic acidosis, nephrolithiasis, that's a possibility to be caused by this medication. In addition, you want to keep in the back of your head that topiramate has the potential to cause issues with sodium bicarb and renal function, so that you'd be wanting to monitor their bicarb levels. Now, side effects from this medication, there are a lot. Cognitive changes in particular can be quite troublesome. The individual may experience numbness, burning, tingling in the extremities. The cognitive changes can include slowed reaction, difficulty concentrating, irritability, aggressive behavior, difficulty thinking of specific words, and memory problems. And in terms of cognitive changes, the person may say something to you like, I'm feeling really stupid. I can't remember things like I used to. I can't even say the ABCs anymore. Now, should they say something like that, that should give you good warning to the fact that this medication may not be the medication that you want to keep this person on. They also may develop speech problems, have clumsiness or lack of coordination, and become increasingly nervous. An additional side effect may include weight loss, which the person needs to be warned that it can produce weight loss. Should they not be told, or they forget, they may develop unnecessary anxiety as they lose weight without intending to. For some folks, unnecessary weight loss, or weight loss that isn't planned for, may indicate to them either they have developed some severe illness such as cancer, or perhaps that they had developed some undiagnosed wasting disorder. So it's important to let the patient know that one of the side effects may indeed be weight loss. For many, they may celebrate this side effect, but they do need to know about it. Now, in comparison, for price, acamprosate is about $43 a month, and all of these medications have little stars after them indicating that this is with a coupon or a discount that these prices are. And this was obtained off of goodrx.com earlier this year, so the prices are fairly well up to date. You'll notice that the naltrexone IM, which is given once a month, is very high. This may or may not be covered by their insurance company, so this needs to be taken with consideration if you're looking at this medication choice. Safety considerations: you're going to want to monitor liver function tests for naltrexone and disulfiram. You're going to check creatinine levels for acamprosate and topamax, the topiramate. You're also going to check bicarb levels for topiramate. In terms of pregnancy categories, the first three are all pregnancy category C, and topiramate is pregnancy category D. So for sure, you want to ensure that the individual is not pregnant before you begin topiramate.